Honorable Barbara Lee, who co-authored the Lantos Hyde U.S. Global Leadership Against HIV/AIDS bill signed into law last week, and was instrumental in repealing the stigmatizing HIV immigration and entry ban from federal law. Representative Lee chairs the Congressional Black Caucus Task Force on HIV/AIDS and is leading efforts in Congress to improve HIV prevention services. Please give a warm welcome to U.S. Representative Barbara Lee.
Well, good afternoon, and let me just thank you so much for being here. Thank you so much for your work each and every day. We all know that, yes, we will stamp HIV and AIDS from the face of the earth. Thank you again so much. Let me thank you, David, from the AIDS Foundation of Chicago, for all of your work and for serving as co-chair for this really important session, and also to all of our panelists today. Let me just acknowledge and thank the IAS and Craig McClure and Dr. Helene Gale, because when I talked to them about having a focus in a session looking at what is taking place in our own country, they got it so quickly, and they said, let's see what we can do, and here we are today. So I just have to say to the IAS and to Craig McClure and Dr. Gale, thank you very much for bringing this focus to this wonderful International AIDS Conference. Of course, with the release of the new HIV incidence numbers from the CDC, this satellite session could not be more timely. That's right. Will you all kind of check out what they're saying to you today? And let's give them a round of applause. Now let me say, I have been a delegate at each of the last 5 international AIDS conferences, including of course this one, and I've long spoken about the need to integrate the U.S. HIV/AIDS epidemic into discussions about the global pandemic. At the last conference in Toronto, we saw the first major discussion of HIV and AIDS among the African American community. We were pleased and we were participating with great leaders such as Julian Bond of the NAACP, Congresswoman Maxine Waters, Congresswoman Donna Christensen, and many other prominent African Americans. I believe that this time around in Mexico City, we have gone one step further. The thought-provoking and groundbreaking report from the Black AIDS Institute, Left Behind, has for the first time equated the epidemic in Black America in terms that the international community can understand very clearly. It has really shown some sunshine into what is going on in the United States of America. If Black America were a separate nation, it would rank 16th in the world in the number of people living with HIV. The release of the new incidence numbers by the CDC are frankly confirmation of what many of us have said all along. Of course, we know, just as with the census in America, communities of color are always undercounted. We knew that there was a glaring undercount as it relates to HIV and AIDS in the African American community. So I'm glad that CDC has finally acknowledged what we knew all along. Thank you, Dr. Fenton, very much. Dr. Fenton will, of course, discuss the numbers themselves. And let me just say that, of course, we all have been disturbed to read that the estimate of the new annual infections had risen by over 40%. However, it's no surprise that 45% of infections were among African Americans and 53% were among men who have sex with men. Clearly, we have not done enough to address the AIDS epidemic within the African American community, within the Latino community, among men who have sex with men, with African American women, but those who I'm most concerned about are young Black gay men who carry the burdens of both of these communities. The U.S. failed to fight AIDS. Thank you very much. We do need to reinvigorate and revitalize our response to our own epidemic. I hope that the CDC numbers and the Black AIDS Institute report will help spur the political will. And let me tell you, it takes a lot of political will. I serve on the Foreign Affairs Committee, and I'm also on the Appropriations Committee. I'm on the committees that fund our foreign development assistance initiatives and the subcommittee that funds our domestic HIV/AIDS initiatives, Ryan White, our minority AIDS initiatives, and I can just tell you, the political will is not quite there yet, with the exception of members of the Congressional Black Caucus and the Hispanic Caucus and the Progressive Caucus. So we have to understand this is a political struggle also, and begin to mount a major political battle in America to combat HIV and AIDS with the seriousness and with the urgency that it deserves. That's what we've got to do, and our brothers and sisters are beginning that right now today.